Today on 21st Century Television, join us as we explore innovative technologies, cutting-edge solutions, and timely discussions from leaders across the globe. This is 21st Century Television.
Welcome to 21st Century Health. I'm Jackie Bales. The healthcare services industry is constantly facing pressure to get better results per claim at a lower cost basis. The desired result is to handle more claims while keeping costs low. However, achieving this cost containment can be quite difficult. To discuss this important topic and how his company, MCMC, helps carriers, employers, and agencies solve this problem, we have with us President and CEO Michael Lindberg. Welcome, Michael.
Thank you, Jackie.
Michael, what are the biggest factors that drive up the costs of medical claims?
The biggest factors today are probably frequency, the amount of care, ongoing care that occurs, the duration of that care, the length of time that the care is ongoing for, and the aging population in America, which is a demographic factor that as people live longer, there's going to be more care out there and there's going to be more need for alternative care, particularly as people age.
Definitely. So how is MCMC helping your clients reduce their medical claims costs?
We actually do a couple of things that are specific to controlling medical costs. One is that we will review complex cases for payers that have a health plan in place that at a certain point of care, based upon the duration, treatment type, or lack of a better outcome, they want to review it to determine should they change direction of that care, is there an alternative they should seek, and that's one of the things that we do. Another thing we do is review large complex cases for the medical bill appropriateness, whether or not the bills are appropriately being paid, if it was a network provider or a physician that's in a network, was there a discount that is applied there, if it was a hospital, was there a negotiated rate with that hospital, just making sure that people are getting the high quality care at the lowest possible cost by doing a concurrent and retrospective review, as well as sometimes doing prospective decision making with the payer on what direction they should take.
So who is MCMC and what services do you provide?
MCMC is an independent medical cost containment firm. MCMC stands for Managing Care and Managing Costs. On the managing care side, we do things like independent medical review, where we contract with physicians across the nation that are specialists to review complex cases. On the cost control side, we also do things like medical bill review, where we review medical bills and records to make sure that the appropriate reimbursement is being administered. And the networks that are contracted are all different types of networks. They're global networks, they're regional networks, they're specialty networks. We have offices around the country that handle clients that are basically from New York to California and down here in Florida as well. And we have almost 1,000 individuals that work with our firm to help us control costs and manage care.
When it comes to workers' compensation claims, the healthcare services industry is facing pressure to get better results at a lower cost basis. The goal is to manage more claims without escalating the medical cost per claim. MCMC is an industry leader whose cloud-based application, Zebra, allows clients to access providers, services, reports, and more, all within a dashboard that helps control medical and claims costs.
I feel that three differentiators for MCMC are our technology, our flexibility, and our independence and void of conflict with PPO networks and claims.
What MCMC tries to do to improve service is to provide transparency for the client, to allow them to see and interact with the information that we're handling for them so they can make the best decisions.
Some of the issues that our clients face in managed care are their claims costs, trying to decrease their claims cost, and also decrease the length of their claimant's time off of work.
Michael, what is managed care exactly, and how does workers' comp and group health differ within this designation?
Well, managed care really has been around for a long time, but it really wasn't defined as managed care. It started with case management way back when nurses were assigned to certain types of cases to help coordinate the care, and it evolved into then managing physician networks, as well as selecting the appropriate providers that were the highest quality providers, and doing things like medical review and determination. So managed care is really a service that's provided to the payers for the most part because they're paying the bill, but it's done privately and independently, with firms like mine, in order to get the best outcome at the lowest possible cost. And we tried to do it void of conflict because we don't actually own the insurance policy and we don't own the claim. So we're void of conflict and we're reviewing it for appropriateness, quality, and potentially the best outcome direction.
How exactly are medical costs controlled?
You control the medical costs by selecting the best provider as early as possible in the care cycle. You don't want a case to treat for 3, 4, or 5 months with an inappropriate provider. Not that the provider is trying to do anything wrong, but it may not be the appropriate provider based upon the condition that the person has. So therefore, getting them into the appropriate specialist provider as early as possible, and then getting that frequency of treatment down to a minimum at the highest quality level. That's really the first thing that you want to do. Then you also want to make sure that that provider is in a physician network that is in the health plan or the workers' comp program, has selected panels of providers that are in their network, because that allows for the payer to get a discount on that quality care.
Interesting. So why is independent party review needed then?
Independent party review, I believe, actually helps both sides of the equation, the patient and or the claimant, as well as the payer, because typically what happens is a case or a claim gets to a point in treatment where the payer is not sure that it's the appropriate care, or the direction of care may not get the outcome that they would like, which obviously the outcome is to get people well. If it isn't happening and they want to determine whether or not there's an alternative route, that's when an independent review will be brought in to determine what is out there as either similar or different treatment that might change the direction of care to get a better outcome.
And what is the experience of the patient as all of this is going on? Is the patient being told this is what you will receive? Or how does that work?
In the health world, the health plans write it into their plan that they have the ability to do an independent review, typically on complex cases that they need an outside independent review organization to work on. We bring in specialist providers. We contract with them. We don't actually employ the provider. They're active practicing doctors, and they review cases that are in their area of expertise. And so we get involved to basically help determine where they should go next on a case. And it's not a high percentage of the population. 80–90% of all the care fits into the plan guidelines, goes as expected. 5, 10, maybe 15% of the care are the things that they need an outside independent party to look at.
Oh, so you get involved in the tough cases then, really?
That's correct.
When does medical case management need to get involved?
We have a saying in our company, early and often. We believe that having a medical professional, a nurse, involved in the coordination of care from the very beginning will help the patient and or claimant, depending upon whether it's health or workers' comp, get to the appropriate provider sooner rather than later, which then results in less of a life associated with that claim and a less duration of the amount of care. So we believe that early is better than late in the case. However, many payers have their own internal medical departments, which obviously they assign the case to their internal medical department, nurses and doctors. And then when they get to a point where a case is very complex or it goes beyond their expertise, they'll farm that out to an independent party, and our nurse will get involved at that point in time.
What kinds of cases are we talking about?
It could be anything from a back injury related to a workers' comp case to a cancer patient, oncology type of review. It could be ongoing pharmacy, recommendations that are being made by a PBM, a pharmacy benefit manager, and they want an independent physician to review the history of that case or claim. So it falls into various different categories, but usually it's the serious, complex, and ongoing care.
Gotcha. So who is it that contracts with the provider?
There's actually two answers to that question. On one side of the equation, we contract directly with specialist providers that have the ability to do the independent reviews, and they're full-time practicing doctors. Okay? On the other side of the equation, in the workers' comp world, we contract with networks that actually put together groups of providers that agree to provide a discount on injured workers' care. So in one case, we're contracting with a network that has providers that they credential into their network. And on the other side, we actually credential providers that are specialists that can do reviews for us on individual complex cases.
In addition to cost savings, MCMC's technology provides ease of use, world-class quality, optimization of service coverage, and coordination of care.
MCMC's technology impacts managed care in a positive way by allowing them the information they need to make prospective referrals into the correct providers, view the information that they have available in the current claim, and look at the information retrospectively to help analytically make decisions.
There are simple technologies that reduce the cost of care, like our bill review program detects duplicate billing, detects and applies fee schedule values, audit savings, and through programs like PPO optimization, we're able to reduce bills to the lowest possible price for the treatment rendered. One of the ways that our technology helps clients to get the best care possible is to work with our clients to develop provider panels. We make that available to the adjusters. They can provide that information that they've pre-selected, doctors that they've pre-selected, to get those patients to doctors that they know are going to provide better outcomes in the long term.
MCMC's technology is also void of conflicts while remaining clear and transparent.
In managed care, transparency means allowing our clients, giving them information enough to sift through this vast sea of data. I mean, there's so much information out there. We try to give them the right information at the right time to allow them to make a decision about a claim, a case, a bill, right when it's needed.
Through its ease of use, transparency, and coordination of care, MCMC's Zebra platform is helping companies manage their medical spend to attain quality outcomes while controlling cost and facilitating their employees' return to work.
How does the patient or the claimant benefit, Michael, from your services?
The patient and or claimant benefit because if we can be an unbiased, independent third party and review it from a quality focus based upon expertise with an enormous amount of data and history that we have related to all different types of cases and claims. We'll review it independently and determine which direction the case should take. By doing that determination independently, the payer then has a recommendation that's not just an internal recommendation, it's an external party that is looking at it. And our job is not to just cut costs. Our job is to get the best quality care at the lowest possible cost. So we're really an advocate, if you will, for the patient and the claimant, but we have an eye on controlling costs as well.
Gotcha. But that all works because you don't have a vested interest in the payer's side.
Correct. We're not writing the check for the claim. We don't bid on handling the claims. We provide the service to those people that are managing the claim.
Very interesting. Now, why is the physician care questioned in some of these cases? Is that just as a matter of course?
Usually there are 2 or 3 different things. One, the plan may have defined in it that certain types of care they want to review after a certain period of time, duration, or dollar amount. Other times it may be that it's a complex case and there's multiple different types of treatment that could be pursued and they're not sure which one is the appropriate one for their patient. So that's another example of an independent review comes in nicely there. And then the third area would be where you have what I would call red flags. A flag is something that would indicate to the payer that something went wrong related to the treatment and maybe they should look at an alternative course. And so they'll send it out for an independent review to determine, you know, what we're seeing in this case looks like it's not the norm that we expected. What should we expect? What are the alternatives and what are your recommendations?
So let's talk about accuracy. What basis is used to review care or billing for quality accuracy?
So there are numerous different medical resource databases. Some of the ones that we use, I'll use the acronyms and then I'll describe them, but ACOM, ODG, Millman Care, these are all definitions of resource bases that we use. InterQual is another one. And basically they're occupational medicine guidelines, they're evidence-based medicine guidelines, and they're disability guidelines that are resource databases that are independent resource databases owned by other private enterprises. And we contract with those enterprises to get that information and match that up against our own experience on cases and claims and medical bills.
So it's like a subscription service then, basically? You're subscribing to that data,
Yeah,
so you can use that?
We will acquire that information through contract, and then we will load that information into our proprietary applications. And when we review a case, a claim, or a bill, we'll match up the appropriate criteria to either the billing history, the case history, the diagnosis and treatment background of that patient and claim, and we'll use those resources to make sure that we're making the appropriate decisions.
I think there's three differentiators MCMC has. First, it's they're independent. Unlike some other organizations, they're there to put the best possible package of solutions together. In addition, they have some excellent technology. Their Zebra system allows for very quick analytics, look into different claim files, understand what's going on, look at different bill review on the WebOPA system, etc. So their technology is very user-friendly. And then finally, it is, from a customer service perspective, I have found in my experience that they are excellent in that area. So they have implemented managed care programs at a couple of my large payer clients, and to their credit, they have done so quickly, efficiently, and whenever problems have arisen, MCMC has taken responsibility for that, done what they need to do to fix that and make that happen. So as healthcare costs continue to change, as Affordable Care rolls out, there's going to be significant changes in the delivery system, and that delivery system is going to affect group health, Medicare, Medicaid, as well as workers' comp. And that puts a premium on an organization that A, is not beholden to a particular business model or a particular set of networks, and B, has very flexible, very user-friendly technology.
So lastly, Michael, you know, healthcare has been changing quite a bit. What does the future look like for MCMC and your industry?
Our industry, I believe, will continue to evolve with independent third parties like ourselves providing services to larger entities, payers, employers, third-party administrators. And I believe that there'll be an evolution in the managed care industry as it relates to broader access to care, and that is going to continue to require independent reviews to be done, as well as the appropriateness of medical treatment is going to have to be reviewed, and the dollar amount that is spent on that treatment is going to continue to have to be reviewed. It's very difficult to track all this information. In the workers' comp industry, it's state-specific. In the health industry, it's plan-specific. And as an independent party, we can load that information into our proprietary applications and help those people make better decisions.
Wow. Thank you so much, Michael, for coming on the show today and for sharing MCMC's managed care programs and solutions. It's very interesting.
Thank you for having me.
For 21st Century Health, I'm Jackie Bales. Thanks for watching.